Ovarian insufficiency leads to an estrogen deficiency. So estrogen is depleted, which leads to a very specific type of skin for women experiencing perimenopause, specifically increased wrinkling and decreased elasticity. And I want you to know that estrogen is something that helps us with elasticity and our collagen. Okay, let me show you. So estrogen does affect our collagen and the elasticity in the. This is a study from JAMA Dermatology from 2008. So let's look at another article. So in this article from 2019, estrogen deficient skin, the role of topical therapy. So menopause is a major turning point in a woman's life that is characterized by declining ovarian function and decreased serum estrogen levels. The resulting hormonal changes particularly affect the skin, with the postmenopausal symptoms of loss of structural architecture, increased propensity to damage is becoming noticeable. Interestingly, studies have shown that estrogen deprivation in postmenopausal conditions accelerates many skin changes, including dryness, atrophy, which means shrinkage, fine wrinkling, and poor wound healing. Thus, the effects of low estrogen on skin are an important endogenous cause of aging skin in women. Yet, topical treatment strategies that target cutaneous symptoms are limited. The goal of this article is to provide an overview. Okay, so they're saying we are treating the root cause your estrogen loss is causing. There could be an intervention to help this estrogen deficient skin. So, our skin's aging is a result of the combination of chronological, environmental, genetic, and hormonal factors. Because your low estrogen state and the resulting skin manifestations can happen because of lots of different causes, such as menopause. Please remember that estrogens are steroids that are made from cholesterol in the ovary in premenopausal women and in peripheral tissues postmenopausally. Welcome, belly fat. It has entered the conversation. Two estrogen receptors, alpha and beta, have predominantly been identified in the skin. So these receptors are what that topical estrogen would bind. And not only having those receptors, but how they express themselves, how they are used. And so their expression levels decline from the perimenopause years onward as you enter postmenopause in this estrogen deficient state. And the estrogen receptors bind to estradiol with a similar effect. Many studies have shown that when women enter menopause, women begin to detect a swift commencement of skin aging. And one of the first symptoms experienced is increased skin dryness, followed by decreased firmness and elasticity. And these symptoms are showing how there are structural and architectural changes in the skin because we're not producing things the same way. We don't have the same amount of collagen, because remember, after 35, we're not producing that same amount, the thickness of the skin, and how the elastic works. Remember, I've been talking about elasticity with our muscles and our ligaments because estrogen is a very important piece in our elasticity. Estrogen also helps to retain the moisture within the skin through the production of sebum secretion, and it also helps to regulate the expression of, and this is wild, insulin like growth factor receptors and increasing the production of insulin like growth factors from fibroblasts, which in turn induces lipogenesis in human sebocytes and leads to moisture retention. Additionally, estrogen therapy elevates the levels of the mucopolysaccharides and hyaluronic acids in the dermis to keep the skin hydrated. Okay, so estrogen helps with moisture, estrogen helps with remodeling, estrogen helps with fibroblasts, elastin, insulin like growth factors. It is very much a part of our metabolism, our buildup, and our breakdown. Studies have shown that up to 30% of dermal collagen may be lost in the first 5 years after menopause, and collagen decreases by approximately 2.1% per year. Likewise, the skin thickness decreases 1.1% per year. Might I also tell you this is how your bones become osteoporotic? So, your bones, your muscles, your skin are all affected by this estrogen. So, treating with estrogen is treating the actual underlying deficiency. And when you begin to notice those skin changes, that structural architecture, the thinness, the fine lines, you are witnessing the change in your collagen and your elastin. So tretinoin or retin A does increase the or retinoids production of collagen, but in a different way, in a different pathway. And there is a higher likelihood of irritation technically with that compared to estrogen, but different pathways, different effects,